Good morning. I'm Dr. Victor Politi, and welcome and thank you for tuning into Health Talk. Health Talk from National University Medical Center. So as healthcare is changing here in America, NuHealth, National University Medical Center, is part of that change. So this half-hour program will provide you with essential information about our services and facilities that provide top quality care that fits into your lifestyle. NuHealth's roots go deep into Long Island history. What began in 1935 as a 200-bed general hospital has now become part of a unique health organization with multiple centers of care and a commitment to deliver excellent, essential care to everyone at every stage of life. Our improvements at National University Medical Center are making us a leading provider of both primary and tertiary care services that rival the best in the country. So we all know National University Medical Center. We see it on Hempstead Turnpike, that 19-story building. It's a pretty big building. One of the highest in Nassau County, actually, if not the highest. I think North Shore Towers is about the same, but they're sort of in Queens. So we're in Nassau County, and it's a great medical facility, and it's been going through a lot of changes over the last few years. No longer is it Meadowbrook Hospital. No longer is it that county hospital that really is, not held at a reputation that really is not true any longer. We've brought in a lot of top doctors. We've brought in a lot of specialists. We've expanded the services and changed that hospital around. And there's so many different things that are going on in Nassau County and Nassau University Medical Center that really makes that a real state-of-the-art hospital. And this show on Saturdays are trying to get out the word. We're trying to tell people of different services that are available at Nassau University Medical Center and how the changes that have been occurring over the last year really put us on par with any of the special hospitals here in Nassau County. So we on Saturdays I try to bring in different guests from different specialties of the hospital, different areas that talk about their particular expertise and about the services that we have at the hospital. And so that today is no different because other than the hospital we have other services as well. We have a very large extended care facility, senior center, which is called A. Holly Patterson over in Uniondale on Jerusalem Avenue. It's a 589-bed skilled nursing facility that really is always given high awards. We awarded 5 stars by national rating agencies, which is really one of the few 5-star senior nursing facilities, skilled nursing facilities here in Long Island. But in addition to that, we have lots of primary care centers, what used to be called clinics, family health centers and clinics, primary care centers throughout Long Island. And we call them the federally qualified healthcare centers, Long Island FQHC. And they are sponsored by Nassau University Medical Center together with the community to provide these services in community-based health centers. So these health centers are in different areas, and we'll talk about them as we go along in the show, but they're there and they provide a full service environment for your healthcare needs. Again, top doctors, board certified doctors, top nurses, all the resources that a full tertiary hospital can provide through Nassau University Medical Center, and we work together with them very, very closely. So today we have Dr. Gray, who's the medical director of our Long Island Federally Qualified Health Center, who will be talking to us about the FQHCs, the health centers, and tell us about the different services they have. So, Dr. Gray, I want to thank you very, very much for being here with us this morning. Appreciate your time. And why don't you tell us a little bit about yourself and where you trained and what kind of work you do?
Okay. Hello, good morning. Thank you, Dr. Politi, for having me. My name is Tarika James. I am the medical director for the Long Island FQHC, and I'm very excited to be here. So thank you for having me. The Long Island FQHC is an organization that is designed to provide comprehensive primary care health services to the community. We have 5 locations. One of our locations is in Roosevelt, New York. We have one in Freeport, New York, Westbury, Hempstead, and Belmont. We also have a high school-based health center in our Roosevelt High School. And what we do as an FQHC, that means that the federal government decided that areas that had high need for primary health care services, they were willing to provide grants to help cover the cost of health care for patients who normally would not be able to afford health care, either because they are uninsurable, maybe they're undocumented minorities, or that they're underinsured, meaning they only qualify for Medicaid-based care. So the FQHCs are really designed to help to meet the need of the community regardless of their ability to pay. So we don't turn patients away even if they're uninsured. We don't just provide a clinic-based setting, Dr. Politi. We're meant to be a medical home for the patient, meaning that that patient, when they come to us, will be able to determine who they want their primary doctor to be, and then to continue to see that doctor on a regular basis to meet all of their primary care needs, whether it be any acute illness they have or whether it just be their preventative health care services.
That's true, and I misspoke. First of all, Dr. James, I'm so sorry, yeah, and I understand that the federally qualified healthcare centers, it's a medical home, and
Yes.
so someone who lives in the community and doesn't matter what method of payment they have can come to you, establish themselves with a primary care physician,
Yes.
and basically all their needs will be taken care of. Sort of like a
Yes.
quarterback. So you'll be really doing everything that I might need. So if I come to you, you're my primary care doctor,
Yes.
and you check my blood pressure and get routine laboratory tests and do a full physical exam. Hey, I'm 50 years old. I need a colonoscopy. You'll help arrange that. Or hey, my vision is getting a little blurry. You'll send me to the ophthalmologist. So really, everyone, I think everyone, particularly in some of those areas that you mentioned, need a primary care doctor. You need someone to get on top of these healthcare issues and really prevent catastrophic illnesses.
Yes.
Right?
Historically, primary care is known as the gatekeeper for health, right? Meaning that that primary care doctor is really responsible for every aspect of your health. And if it's out of their scope, meaning it requires a specialist, they're the ones who make the determination and help you get the referrals that you need to go into the specialist. And when we have patients who have specialty needs, we refer them directly to Nassau University Medical Center for Health.
So what was your background? What kind of training did you have? Family practice?
Yes, I'm a family physician, and I was trained in Drexel University Medical School.
Great school.
And I then did my residency at JFK Medical
Oh.
Center in Edison, New Jersey.
Sure, yeah. I was over at Robert Wood Johnson in New Brunswick.
Oh, that's a neighbor in
Next
hospital.
door, sure. I was internal medicine, also primary care
Okay.
specialty. And so I agree with you 110%. So, I think people today, you don't see the doctor's offices on every corner. At one time, when we were growing up, every block or every community had the neighborhood doctor. He had his shingle outside, and your mother and father, that's where you went to see the doctor. But today, there aren't that many primary care, solo practitioners anymore. They're all joining these multi-specialty groups, whether it's Pro Health or North Shore, and so this is sort of our version of that. This is our Nassau University Medical Center's version of that type of a facility where people can come and you could be that doc on the block. You can have your shingle out there, Dr. James seeing patients from 9 to 5 or whatever it is, and you'll do everything for them to provide the care. So tell me more about the health centers. What else do we have there besides family practice and primary care? What else is going on in those buildings?
So aside from what we consider primary care, internal medicine, family medicine, pediatrics, we also provide OBGYN, full OBGYN services for prenatal care. We provide dental services at 3 out of our 5 health centers. We have radiology services where you can come and actually get an x-ray at the sites. We have specialty services including cardiologist, podiatry, optometry, and we will have a pulmonologist who was on our staff but most recently left. So we would looking to replace that provider. But we're looking to even expand further to include more specialists in the community, because one of the barriers to care is access.
Okay.
And so for some of our patients, they don't have transportation, they don't have access to public transportation due to the lack of having funds. So having a doctor right there where they live in their neighborhood reduces the risk that they may not make it to the doctor's office. So we look to expand our specialty care as much as we can.
Yeah, and I think the most important thing we could do as physicians, or one of the most important things, is preventive medicine.
Yes.
To get people early enough, and whether it's to have a woman go for a mammography and we find the lesion when it's very, very small, because we have that new tomosynthesis machine, that really state-of-the-art mammography machine that picks up even the smallest types of nodules. If we could find someone at that stage and correct that, we could save their life.
Yes.
If we find a tumor or a polyp during colonoscopy and remove that, we could prevent them from getting colon cancer. And so I think primary care is so important. It's more than just, going to see someone to get a checkup. You're so important that you actually catch these issues that people might have hiding in their body before they really take a turn and, cause a life-threatening type of an illness.
Right.
And so it's amazing, how important that the services are, that people don't avail themselves to these things. And a lot of the listeners are may not be from one of your 5 communities, but that shouldn't stop them from following up with a physician to get a routine care. Look, when you're a young person, your parents bring you to the doctors, the school makes you get all your vaccines and all that stuff. And then there's a period we go through in our lives where we don't go to physicians. We feel great, we feel healthy. I'm 22 years old and I'm strong as an ox, and but we really should continue our follow-ups and checkups with our doctors to make sure everything is good, right?
So an ounce of prevention is worth a pound of cure. So if you come in while you're healthy and take the vaccines that are necessary, get the screening tests that are recommended for your age, you can prevent long-term complications later on in life. And that's really what we try to do for our patients.
Right. So besides that, we have other services. I mean, you actually have dental services now, right? So patients can go there and see a dentist in their community. And that's a sign. If you're able to take care of patients and their general health, and now you worry about their teeth, that's saying that, hey, we've gone that far in preventive medicine, we've gone that far in healthcare, that we actually could take care of the dental needs of a patient.
Yes.
And it's great. And so where are the dental clinics? Which facilities?
We have one dental office in our Belmont location, one in our Roosevelt location, our Freeport location, and our newest dental site is in our Westbury location. Just opened today.
Did it? Wow.
So we invite all the patients in the Westbury area to come into the Westbury Health Center on Union Avenue to see a dentist for routine oral care.
Are you having a grand opening tomorrow for some new construction, and you really fixed the Westbury office up really nice?
Yes, we welcome everyone to come out. It's going to be Wednesday from 4 to 8 p.m. Open house. We are giving tours of the facility and allowing people to see the types of services we provide there.
Yeah, that's great. And, dentists, medical doctors, how about behavioral health? Are there behavioral health services available at those locations?
Yes, our behavioral health program is really expanding. We have at each of our health centers a behaviorist, whether it be a social worker, psychiatric nurse practitioner, psychologist, and we even have psychiatrists on staff to provide all behavioral health services.
So it truly is a full-service facility, a full multi-service practice that you provide, and
yes.
We call them, basically, family health centers or patient-centered medical homes today. So that it's just a change of terminology, but really means taking care of everything that patient might need and anything that they might be concerned about, or to keep themselves healthy.
Right.
In those centers. So are you going to expand your days? Are you going to expand your hours? Are you going to be 24 hours one of these days? What do you think?
That's the goal. David Nemiroff is our executive director, and one of his goals is for us to be open at least until 11 p.m. because we're finding that people are using the emergency room incorrectly. Yes, there's a need for emergency rooms when there's trauma, when people are very severely ill, but some people use the emergency room just for cough and colds, for ear infections. These are things that the primary care doctor should be managing. So in order to increase access to care, we're looking to expand our hours from 8 a.m. to 8 p.m. Monday through Thursday, and Friday 8 to 6 in order to meet the needs of the community. We also have Saturday hours now at all of our locations from 9 to 1 p.m. where you can get a full service checkup or any other medical needs met that will help you to stay out of the emergency room and allow the very sick patients to utilize the emergency room.
And that's a good point that you made. So a lot of patients do go to the emergency room for issues that really aren't true emergencies. And you'll see a lot of them going to the urgent care centers. Would you be able to handle patients on a walk-in basis as well?
Yes, all of our sites have same-day appointments, meaning that there's open access slots available for each primary care provider to see patients that walk in, no appointment necessary, see the nurse, and she places you in to see the doctor based on your healthcare needs.
So that's good. So it's sort of like a more of a concierge type of thing. Instead of going to an urgent care and sitting in the waiting room and waiting for a physician to see you, you can actually go to one of these family health centers and see a nurse and actually see a doctor that will basically take care of your needs and could actually follow you after you leave.
Right.
So you can actually make a relationship, or have a relationship with the doctor that you see at at that family health center, as opposed to walking into a doc in a box and getting an antibiotic and a prescription. Well, heck, that's just great for the sore throat, but what if there are other issues?
Right.
And that's where you guys come in.
So we have a full service electronic health record that is the same across all the health centers. So if I saw you today in one site and you decided to visit another health center, all the doctors there will be able to access your entire medical record. Also, the hospital, Nassau University Medical Center, has access to our health records as well. So there will be a full continuity of care. Would miss an important medical history that may affect your care.
So your doctors are associated with Nassau University Medical Center.
Yes.
And we know that Nassau University Medical Center has been going through some really amazing changes lately. Whether it's the physical plant where things are being upgraded and repaired. There's a $38 million emergency room. They're doing a primary care center there as well at that facility, which is about $24 million to build that out. I know we've hired a lot of housekeepers, a lot of engineering people. The place is immaculately clean. I mean, people are amazed, and they walk into that lobby, and there's all those terrazzo floors, and it's just shining clean, and the elevators are immaculately clean. You're like, wow, this place is not what I thought Nassau University Medical Center was. And then we looked at other stuff. I mean, we went up brand new ICU, CCU, and MICU. So we do a lot of critical care. We do a lot of trauma, a lot of heart attacks, strokes. Really, when people are really sick, the ambulances come to us. I mean, we are a level 1 trauma center. Helicopters are landing there all the time with the sickest of the sick patients. So we're good at that. We're good at trauma. We're good at critical patients. We have those intensive care units up there, all brand new. Orthopedics, lots of trauma, lots of fractures, spinal care. Beautiful brand new area up there as well. So Nassau University Medical Center is changing. We're really getting to become a real leading player in Nassau County as far as a hospital. And now we need to get that word out. We need to let people know, and we need to reach into our communities. And the Long Island Federally Qualified Health Centers, the health centers, family health centers that you're running, really get us to that point. They really are out in the communities. They're in those communities that are in the greatest of need. And you're reaching out to those communities. You're bringing those school kids in. You're bringing those elderly people in. You're getting them on medication, and you're following them so that they can, prevent major heart attacks, prevent major strokes and cancers. And it's really amazing.
We also provide full primary care for HIV positive patients. We have family planning grant services to provide low-cost birth control and STD treatment and testing and treatment for all patients. So we have several means of funding to help take care of patients who normally would not be able to afford the care.
Right. And these are the patients that need it the most. And they have a very high, incidence of having critical illnesses, heart attacks and strokes. And by you catching them early and treating them early and making sure they take their antihypertensive medications and their diabetes control and watching their hemoglobin A1C and taking their insulin and watching what they eat, you actually add many, many, many years to people's lives and more years they could spend with their families. And that's really what it's all about as being a doctor, I think, is keeping people healthy and making sure that they can go to that next graduation or they can go to the next baby's christening. And it's so important that we do that to them.
Yeah. So as a primary care facility, we also are a part of the National Committee of Quality Assurance has given us the designation of a patient-centered medical home. And what that means is that we take chronic disease, patients who have certain illnesses, and we do like a full comprehensive evaluation of the patient. If they have diabetes, for example, we would refer them to a nurse who will be their care manager. She would make sure they get the shots, make sure they see the specialist that they need to see, that they get the lab work done in a timely way to make sure they stay the healthiest they can be.
Yeah, and that's important. Diabetes that's a disease that really needs to be controlled, and patients that have it, that watch their diet and weight and exercise and take their medication, really can control that as well as anyone without diabetes.
Definitely.
But if you don't, and you don't watch yourself and you gain weight and you eat sweets and you don't take your medication, you build up cholesterol on your arteries, plaque on your arteries, and it leads to vascular problems and bed sores and ulcerations on your feet and glaucomas and cataracts in your eye rather, and things that really affect your daily life. And so it's so important for something with our diabetics, and the fact that you have this go the extra step at your facility to watch closely how these diabetics are being watched is really adds years and years to their lives.
Definitely.
So, I mean, people listening on the radio show, even though they may not be going to the FQHCs. They may not be going to, some of the family health centers. They have diabetes. These patients, people listening right now have hypertension. They have diabetes. They have asthma. They have heart disease. And so, when we talk about it in generalities about what we're providing to patients in our centers, we're actually talking to you guys out there that are listening that have any medical issues, that it's so important that, right now you take care of yourself, that you watch your weight, exercise. It's if it's a beautiful day out there, get outside, walk around. Don't watch that TV. Get out there and do things. Watch your diet. This is a great time of year. Start eating more fruits, more vegetables. Stop eating all those sweets. Even if you're not diabetic, stop eating all those sweets. And I'm like the worst offender, so don't. But it's the truth, right? I mean, just to stay healthy. I mean, that's what we should be doing.
Definitely. Another thing we do is we do a lot of outreach into the community. We provide screenings at local community fairs. We partner with several community organizations to provide services even outside of just primary care. We have WIC offices in our health centers that provide food benefit programs to women and children. We also are looking to expand our services to even more communities that have high needs. So we're constantly trying to find areas where there are high pockets of people who have chronic illnesses and don't have access to primary care services.
Yeah. And those are the patients that need us the most. They don't realize they're working 2 jobs, they're taking care of their children, and they don't realize about their own health.
Yeah.
They're so concerned about their family. They're so concerned about working that they don't take care of themselves. And you listen, they need to watch themselves, and it's so important for their families that they do.
Definitely.
And so, I mean, that's where in some of these areas, that's where these health centers come into play. We're right there. They could walk to it. They could take the bus there. We can help provide transportation if need be, and they're able to see the physician, to see the nurse practitioner, to get involved in their health care so that we can keep them around for a long time, take care of their kids and to continue being that breadwinner for that family.
Yeah, one of our newest initiatives is we joined the Belmont racetrack, actually. There's a health center in the Belmont racetrack that provides primary care services to the backstretch workers. These are the people who take care of the horses prior to the races. And so Belmont and the New York Racing Association has decided they wanted to fund the health care of their workers. And so they asked us to come on board and to help run the health care facilities over at the Belmont racetrack to provide primary care services to the workers as well.
Great. So what are you doing? Are you opening up that's just for the employees of the racetrack?
Right. It's just for the employees of the racetrack, and it's meant to be a way for them to have access to primary care where they may not also have the ability to afford it. So.
And those are so lower paid gentlemen and ladies that working there at the racetrack who basically have diabetes and hypertension and all the things.
Yes, they have all the same chronic conditions.
And so we're actually bringing the health care right to them at that facility.
Yes.
Oh, what a great idea.
Right on the campus of the racetrack. They have dormitories where they live, and they stay there like seasonal workers. So during the time when the racing season is here in Nassau County, they're here, but then they leave and they go to Saratoga part of the year. But there's a total of about 2,000 backstretch workers
I had no idea.
that travel through the Belmont racetrack that we would be able to provide.
We just had the Belmont Stakes, right? And that was
had
amazing.
a Triple Crown winner.
Yeah. Did you go? Did you see it?
No, I didn't get to see it, but I heard it was a great time.
Oh, yeah. Yeah, there's a lot of people. So right across the street from the racetrack is our Elmont Clinic.
Yes.
Right? It's right down the Hempstead Turnpike.
Right. It's literally across the street. And when the backstretch workers need help during off hours, when the health center is not open at the racetrack, they can walk across the street and get primary care services at the Elmont Health Center as well.
Yeah, and that Elmont provides full service dentistry and have behavioral health. They have everything there.
Yes, we have psychiatry, we have full primary care, OBGYN, dental, podiatry right in the health center, radiology, and we also have a residency training program where we provide training for family practice residents, family medicine residents. We recently had a graduating class of 7, and each year we pride ourselves on hiring at least one of our graduates to join our practice as an attending. So we have one of our residents staying with us.
That's great.
Which is great.
Yeah, it's a very high quality program with Dr. Guiney and his team.
Yes.
that put together family practice residency. That's a 3-year residency?
Yes, it's 3 years.
3 years of intense training on how to keep people healthy and how to take care of disease management. And
that's right.
That's a great
And
field.
these residents also practice continuity, so they keep the same patient for 3 years. That is their patient to manage. And then after along with the residents, they have medical students that they help to train and to grow up into attending physicians. They are osteopathic doctors. When they get out of residency, they have the DO.
The DO certificate, right, which is amazing. And really, the difference between a doctor of osteopathic medicine and a medical doctor, is there a difference between the two?
Very slight difference. We learn a lot of the same medical science, but then the osteopathy has a manipulative medicine where they provide musculoskeletal therapies. Sometimes they use resistance and certain manipulations of the muscles and the spinal cord in order to promote health. Osteopathy also deals with other medications that are like homeopathic, small dose medications that allow the body to heal itself.
So are you a DO doc?
No, I'm a medical doctor.
So we're both MDs.
Yes.
But as far as a DO would have the exact same 4 years of medical school that we had, but they would have additional training, I guess, in musculoskeletal manipulations and nerve pathways and roots and some homeopathic medicine that we as MDs didn't have. But they're fully board certified. They can go into any subspecialty from ophthalmology to radiology to everything, right?
Yes.
Yeah, because people don't know. They say, "Oh, I'm an MD or versus a DO. What's the difference?"
Right.
You know, and so really, it's just a different philosophy, philosophical training with the doctors of osteopathic medicine to include, in addition to the MD stuff, include some manual manipulation and some homeopathic stuff as well. So that's interesting. I always found that very interesting, osteopathic medicine. So your residents go through that. So they have the MD and the DO, but they do some osteopathic manipulation as well?
Yes, they do. They have a manipulation clinic where they have patients come in specifically for musculoskeletal issue and get the manipulation therapy.
And that's what do all your clinics have that? The OMM clinics?
No, right now our residents train out of the Belmont location and the Westbury location.
So they have osteopathic manual manipulation clinics at those two sites?
Yes, they do.
So, I mean, that's, I don't think our listeners know, that is an amazing, for back pain, for any types of musculoskeletal injuries, they do amazing things. I mean, it's not chiropractic. These are DOs. These are doctors of osteopathic medicine that understand the whole pathology and pathophysiology of the diseases to work together with your body. So that's something we should really advertise. We should really let people know, because that is an amazing. There's very few of those clinics anywhere in Long Island. I know that the school, the New York Institute of Technology, NICOM, New York College of Osteopathic Medicine, I think they have one as well.
Yes.
And that's something I'm thinking about opening up at the hospital, at the NUMC.
I think it would be great to add that to our PM&R.
Yes, yeah. I mean, people that come in, with these different illnesses. I mean, it's really amazing. So I think, we'll talk to Dr. Diamond, we'll talk to the different DO guys over at the hospital and see how we can go about establishing that, and maybe using your residents who are experts at that to come and do some of that osteopathic medicine at the hospital.
Yeah, not only do our residents train in the health centers, they also come to the hospital for rotations, and they rotate through all the subspecialties at the hospital. Internal medicine, they do OB deliveries in the hospital, they do all the inpatient care that the internal medicine residents go through as well.
Well, and it's amazing thing. Yeah, I mean, with the family practice, you guys really experience just about every specialty in medicine. You're sort of the expert in everything, just about.
Right. We do from cradle to grave medicine.
Cradle to grave, right? Because you pediatrics and you do geriatrics.
That's right.
Right,
and
right.
GYN.
And GYN, sure. A lot of places in small towns throughout the country, the only doctor is that family practice doctor, is that family medicine doctor. He or she delivers you, takes care of you, treats you, and pronounces you.
That's right. They live with you your whole life. Yeah. They kind of grow old with you, and that's what I love about family medicine.
What a great field!
That you get a relationship with the patient.
Yeah, and you build a lifelong relationship, right? I know family doctors that are treating their children's, their patients' children, and then their children.
That's right.
What a great feeling that is! Really is amazing stuff. And so, we could actually talk for like the rest
I
of the
know.
day. I mean, there's just so many things. We didn't even go down that road yet, and I'd love to have you come back again, and we'll talk about some more of the changes in the health centers, and especially with the growth, the hours, and the locations. And I think our the patients and the listeners would love hearing more about family practice and about the different specialties. So I just want to thank you very much, Dr. James, for being here.
Thank you.
Thank you for spending the day with us, and all you listeners. I want to say thank you for listening. I'm Dr. Victor Politi from National University Medical Center, Hempstead Turnpike, talking today with Dr. James from our healthcare centers, federally qualified healthcare centers that are throughout Nassau County. I hope you guys are hearing what's going on at NUMC. I hope you hear what's going on in the system. We're really making a lot of great changes, bringing on a lot of doctors like Dr. James, who's just amazing, and we're here for you. So have a great day. Stay healthy. And if you need us, we'll be here for you. Thank you.